We have three wonderful patient panelists here today. I hope all of you will take advantage of the opportunity to ask them a lot of questions and gain the patient insight. Marcia Pine O'Brien is a wonderful woman. She is a patient from out here in California, I believe, correct?
Right.
She's been actually an active part of our support groups out here for quite a while. Dr. Jeffrey Winter is a vascular surgeon from Atlanta and also a patient. And Debbie Wooster is actually a caregiver. Her mother was an NTM patient who passed away, and Debbie is the support group leader for our group in Australia. Dr. Tino, I'm going to turn it over to you now.
So thank you, Amy, and I want to thank our three panelists for joining me up here. And one of the things I think that's most unique about a conference like this is a conference for patients as well as physicians. And I've been impressed both in these kinds of forums and certainly in other aspects of my career of the impact that patients and caregivers have on me as a physician, and hopefully on people who sponsor research and the government, et cetera, to really move the treatment of bronchiectasis and NTM along. And I was a panelist at the FDA Advisory Committee in January for inhaled antibiotic, and I can't tell you how impressed I was with the patients and the representatives of the patients, how eloquent and how impactful their statements are about what it's like to live with a chronic disease like bronchiectasis and NTM infection. So without further ado, I thought I'd ask each of the panelists to really talk about their experiences both as a patient, the impact that this illness has had on their lives, and certainly also on the caregiver. So we'll take a few minutes each to describe your experience, and then we'll open it up to the group for their questions. Why don't you take it away?
You want me to just tell you a little bit about my history?
About your history and about the impact of this disease on your life, and what kinds of symptoms that you deal with, and what's the impact on your life?
Well, I could sit here and cough for you, I guess. That would be a major part of my life. Although after I had my right middle lobe yanked out, my coughing was a lot less. I was diagnosed in 2003, but of course, like all of you that have it, I probably had it for a lot longer than that. And I'm good right now. I'm just sort of celebrating each day of feeling good, and I'm off of the antibiotics. I was on 3 different times for a year and a half or so. But I guess I look at everything in a positive light, and even though there are a lot of difficult times and things that I don't do that I used to do actively, I still have a good outlook. And I think that being involved in a support group is a big part of keeping things good and learning the things that are up to date that can help you, and all of the gadgets and shakers, and I think I'm dealing with it well, even though I'm sick, and I know I've got a lot of junk in there, bugs in my lungs.
So what's the symptom that bothers you the most? What symptom or groups of symptoms have had the most impact on you?
Shortness of breath and coughing. Definitely the shortness of breath. I'm actually on oxygen at night and certain other times. But when I walk and talk, that's not a good thing. And when I talk, and I do talk a lot, I get out of breath. And just talking gets me out of breath. So, like right now, I'm not nervous. It's not a nervous thing. It's just an out of breath thing, because it takes a lot of breath to talk. But I'll keep talking.
How much of your day is taken up by taking care of yourself? You mentioned some of the treatments that you're taking. So how has that impacted your daily life? Are there things you can't do because of your symptoms and because of your illness?
I do everything. Because I take a positive attitude, but there is a chunk of time every day that goes to NTM, and that starts with the morning with the shaker, the vest. I like to say that's what it is like, and you know what I'm talking about, but it's entertainment for the grandchildren. And then all the other little gadgets, the things that make you cough and choke and huff and puff, and all of those kind of things that you do to clean out your lungs. So I would say that takes a good couple of hours every day, at least. Every day, every week for the rest of your life. And that's what you do. And I really don't like it. I mean, I guess I should embrace that part of it, but I really don't like it. If I could not do that, that would be great.
So what message would you like to deliver to the providers and fellow patients in the audience? What message would you like to leave them with?
Find one little pill that I could take, and that would be done with the whole thing. Just find a cure.
Okay, thank you.
But
Jeff?
thank you all for what you do. Sorry.
No, it's okay. Jeff?
So
we met last year.
We
at
did
this
at
conference.
Georgetown at this conference last year. When Amy sent me the email about being on, I was like, am I a doctor, am I a patient? Which hat am I going to wear? Do I wear a jacket and put slides up and show you my CAT scans, or do I just tell you what happened to me? And so I'm a patient today. I'm a practicing vascular surgeon. Actually was on call last weekend, worked the entire weekend. I work in my airway clearance into my day. What happened a few years ago, I had a cough that I've had probably for 10 years. I thought it was my ACE inhibitor, being the smart doctor that I was, and I was like, blood pressure's fine, I'll be fine. And my wife, who's a much smarter doctor than I am, said, you know, your cough is getting worse and getting worse. And then all of a sudden, it started getting productive. So I went to one of our community pulmonologists and told him, and I said, let me let you know that my father was diagnosed with CF in his late 70s, and he had classical pseudomonal pneumonias, had bronchiectasis. Just telling you, if it's weird, it could happen, especially to a doctor. So he treated me with a Z-Pack, and I had a little exacerbation, went away. A couple months later, happened again, only worse. This time I was coughing so hard, I ruptured a little blood vessel in my vocal cord. I go, something's going on. And then it happened again during the summer after traveling into Europe, coming back, and I was like, I need a CAT scan. This is just ridiculous. And the CAT scan, when it came up, I was like, time to go home. Because as a physician, the initial reading was they had to rule out whether I had tuberculosis. And we get PPD tested every year, so I was like, I don't have tuberculosis, but went home, and then I called one of our infectious disease specialists, and she said, you need a trip to Denver. You know, and I had to wait for the health department to get my PCR to make sure I didn't have TB, and I came back with Mycobacterium abscessus. And then I started looking at the CAT scan, and I go, this is my father's CAT scan. It's same thing. I have what he has. And from there, it's been Mycobacterium abscessus. And at first depressing, because I was like, I'm a practicing vascular surgeon, how is this? And the cough was getting worse. And then you kind of take control of it, and you say, you know, I'm not going to let this take over my life. I need to do the things I want to do. And went to Denver, started airway clearance. I'll give you my typical day. I get up at 5, between 4:30 and 5. Now, I'm on inhaled amikacin, so it takes longer, so I have to get up a little earlier. And I do my aerobica, my airway clearance, my vest, and I get to the hospital at 6:15. I'm operating at 7, work in the hospital till I get home, do some cardio, work out, do my airway clearance, do it again. And it's just become part of my life. I do not let it take over my life. I can try to control the disease. Feel better now. I was diagnosed now close to 3 years ago, started IV antibiotics last September. After 2 months of IV antibiotics, I became culture negative for the first time. And so now I'm on triple azithromycin, chlorphazamine, and inhaled amikacin for the next 18 months, as long as I remain culture negative. And I do what I want to do. I come to San Diego, I pack my vest, and I pack my aerobica. I've been to Europe. I actually seen a lot of the speakers in Milan last year. And you have to live with it. And if you have to live with it, you have to beat it. And in order to beat it, you have to take over the disease and fight the disease. And one thing that's very important, you're your best advocate. as a patient. And so you really have to, I mean, my going to Milan as a vascular surgeon was to see what's new. Like constantly try to keep up with new drugs, new therapeutics, whatever is out there. And then we're part of a support group in Atlanta and try to bring some of that information back to the support group. So it's actually, I don't even go to vascular surgery meetings anymore. It turns out I go to lung meetings, which is a little bizarre.
So Jeff, you have obviously a unique perspective of being both, obviously, as I said, a patient and a caregiver. So what a patient and a physician. What advice do you have to your fellow patients with NTM, and then advice for the doctors taking care of them?
Well, I think it's kind of interesting. I don't work in an academic setting. I work in a community setting, and now there are 11 hospitals in our system. And I'll give you an example. So I see patients with aneurysms and all kinds of. A patient comes in with vascular disease the other day, and she tells me that she had M. avium, but she was treated. I said, how are you doing? And she goes, I'm doing really well. I go, how did you do this last flu season? She goes, I had pneumonia 3 times. I was like, really? So I was like, did you have a CAT scan? She goes, yeah. I go, well, we're all connected, so I pulled up her CAT scan. And I'm looking at her CAT scan report. She has bronchiectasis. She has mucus plugging. She has the whole thing. And I'm like, do you know you have bronchiectasis? And she goes, what's that? And I was like, that's the problem. And I go, do you do any airway clearance? And she's like, no one ever said I have to do any of this stuff. And as a community physician, I find it very disheartening. Like, I'm lucky enough I went to Denver. A lot of people go to Texas or CU in Penn or Mayo or Georgetown, but for the majority of, we know that the majority of patients are undiagnosed out in the community still. And there really is a lack of care and knowledge in the community. And to me as a physician, very disheartening. A vascular surgeon shouldn't be telling her that, realistically. But a doctor should. And so I was a doctor that day, not just a surgeon.
What's been the biggest frustration for you, Jeff, in terms of being diagnosed with this? Is it the relative paucity of data about treatment? What's been access to care? What's been the biggest frustration for you?
Access of care for me, I mean, I'm fortunate. I have the ability to go anywhere and get anything, and I order stuff from all over the world, trying different little things. But I think it's when we were in Milan and they were talking about new antibiotics, and there are no new antibiotics. And I started the amikacin, and now I buzz. I have tinnitus. Didn't have it before. I was lucky enough to be in Israel last summer, and the AIT people are here, and I contacted them when I was in Israel because it was pre-treatment. I was looking for a treatment option, not to do antibiotics, to try to avoid the side effects, because the side effects bothered me, and I couldn't get into the study, so I was like, well, I have to be treated. And so I'm suffering with some of the side effects, and I'll probably suffer with the tinnitus as long as I live. But I actually do feel better. But I don't understand, and I don't want to ramble, but like why certain drug companies don't test their drugs for our bugs. So in other words, a drug company just came in with a new quinolone. And I was like, does it work against MTM? And he goes, well, let me find out. And he called his medical science person, and he goes, they think it does. Well, I'm like, why don't you test it then? Like, what is that? And they were coming up with a new meropenem. And I was like, why don't you test it? Or I called a drug company for a new macrolide that was supposedly coming out. They wouldn't even answer my email. And I think that's the frustrating part. I mean, it's just, as a physician, you know you need better treatments, better drug. The one pill would be a blessing. But I think that's where I find, that because we're a supposedly small group, but unfortunately growing, that's the issue, is that we don't have good drugs.
Well, we have an industry panel later on this afternoon. It'd be interesting to propose those kinds of questions and their insights to the industry panel, so hold that thought.
I'll be here.
Debbie, welcome.
Oh, thank you. I've just got to say what a privilege and honour it is to be here today. I lost my mother 2 years ago. She was diagnosed with NTM back in 1998. That was nearly 20 years ago. At that time, there was very little known about NTM disease in Australia. She fitted the description. She was tall, slim, active. She'd never smoked. And after numerous visits to the doctor and pneumonia, she was diagnosed with bronchiectasis. She was finally diagnosed with NTM. She'd been on 3 rounds of treatment during that time. She'd been on oral treatments, amikacin, and then she was on the inhaled treatment just prior to her passing. She had a lot of reflux issues, and she was diagnosed with gastroparesis just before she passed away, and that made it very difficult. She said she could cope with the NTM and all the lung management and the lung clearance, but it was just all these other problems with her reflux and stomach issues which made it very, very difficult. Unfortunately, there's not a lot known about NTM, again, in Australia. We have some wonderful doctors in Australia, but we just need more awareness, and my passion is I've started a support group in Australia, and by being here today, I hope that it just helps with us in Australia to raise more awareness.
Tell us about your work with the support group. I think that'd be interesting for all of us to hear.
Well, we've been working on that for 4 years. I'm very passionate about that. I didn't actually know about NTM, or nor did my mother, until we actually visited Rachel Thompson, who's, I'm sure many of you know Rachel Thompson. She's in Brisbane. We visited her clinic and she made us aware of NTMIR. And myself and another patient established a website. That was about 4 years ago, and we've been working with that. And we get a lot of people contact us from all over Australia. They feel very alone and isolated, and yeah, it's just very rewarding working with a support group. And we just hope that one day that we can have a forum in Australia like we're having here today.
How was the support group started, and who actually funds it? Is this...
We do everything ourselves. We do everything ourselves. We've started the website ourselves. We will be looking for funding as time goes by, but we do it all ourselves. Rachel Thompson is very supportive, but yeah, we just do it all ourselves. There's 4 of us that are working together. Yeah.
So one of the voices that we don't oftentimes hear is the caregiver and the impact of a chronic illness. We've seen that and known about it in other forms, but very little is known about the impact on caregivers with NTM disease and with bronchiectasis. Can you share some of your insights and the impact on you?
Well, I lived with my mother the last few years of her life because she was very ill. She was very ill. She'd had a lot of stress in her life too. My father had been very ill, and I think that definitely had an impact on her NTM because she was clear with the NTM, and then when my father got cancer, the NTM came back again. But I was fortunate I was able to work part-time because I was able to devote a lot of time with my mum, but her life was just consistently with doctor's appointments, and your whole life just revolves around appointments and what have you. So yeah, we had a very busy life. She kept very positive. That was one thing she did. She didn't live for the disease, but she never gave up hope, and she was just grateful for the doctors, especially Rachel Thompson and Andrew Burke in Brisbane, who were very supportive of her, because a lot of doctors that we went to, they just weren't interested in the disease. I don't wish to put sort of doctors down, but some of them, they just weren't interested at all.
Well, I don't want this to be a soliloquy on my part, so why don't we open it up to the audience for questions for our panelists? I think we've got a microphone.
Unmute. You raise your hand. You have a question. If you sure, coming right over.
I'm Andrew Collin. I'm a pediatric pulmonologist from Florida, and I want to just ask Dr. Winter, first of all, we'd like to congratulate you for being here. I think for physicians to hear a physician talk about their own disease is particularly poignant. Of course, we deal with patients all the time, but to understand our own vulnerability is a big issue. The other important thing is that I think that the adult world is slowly discovering that diseases that of adults start in childhood, and you probably are an example. And this disconnect between pediatricians and adult physicians is something that obviously needs to be bridged, including in this place, where I think next year I would strongly suggest that we have a session on pediatrics, because NTM is becoming an epidemiologic catastrophe in the United States for children with cystic fibrosis. with this introduction, my question to you is that if you look retrospectively on your own life, where do you think the mistake by a pediatrician has been made where you have not been picked up with your early disease that obviously was there when you were a child?
Interestingly, as a child, I honestly don't remember being short of breath or any issues. The first time I actually, because now I start to think about it, because you start looking back, and when I think back, when I was a surgery resident in New York, we used to run races in Central Park, New York Road Runners, and I'm not a good runner, but would run a 10K, and at the end of the 10K, because of the competitive streak, even if I was way in the back, I would start to run a little faster, and when I finished a race, now looking back, I was markedly short of breath. And now, the way I feel when I get short of breath now, and the only time, honestly, that I do get short of breath is when I work out. That it's the same feeling. It's that same feeling. And I thought it was maybe I was undertrained or stuff. But it's not it wasn't a normal shortness of breath. And I think, and so that was in my mid-20s. As a child, I don't remember ever really being short of breath. Now, mind you, like I said, my father was diagnosed with CF in his late 70s. He was a Holocaust survivor. So he made it through the war, through concentration camp. And the thing that was interesting is he said he never got sick. And he had full 2-gene CF classic symptoms in his late 70s. So the way I look at it is I have some, either the gene that hasn't been, I'm a 508 and I'm recessive, but I'm exhibiting the symptoms, but I'm exhibiting them 20 years earlier, 25 years earlier than my dad had them. And he had full blown. So I don't know if my gene hasn't been found yet, or I just have a mutation of his gene that's caused it. But truly as a child, don't know. Interestingly, my nephew has asthma. And when I got diagnosed, and he went to a pediatric asthma specialist, I told him that he had to go to a CF specialist, pediatric CF, just to be tested. And then all the kids in the family now need to be tested because it's in the family and it's not expressing normally. But to your point is, it's probably been there all along, I'm sure. I would love to have had a CAT scan now 25 years ago to see if it was the start was there, but there's no way to check that.
Well, I'm relieved to hear that one of my colleagues didn't screw up.
Well, he did something else, but...
We have other questions from the audience?
I have a couple of questions. Just to mention, though, I got bronchiectasis and NTM after I had knee replacement. 10 days later, I had pulmonary embolisms and pneumonia. But I also wonder if I may have a recessive gene, but I wonder if it was from the anesthesia. And actually, my sister was just diagnosed with bronchiectasis, and she just had surgery as well. So that could be for some people, I think. Did you have surgery before? Any of you, George? Or Jeffrey? Did you have?
No, honestly, and the specialists are here, but I am a surgeon, and I would say that your DVT and pulmonary embolus probably had nothing to do with your bronchiectasis from a vascular point of view. Mm-hmm. That if you had come to me, I would say you probably had bronchiectasis. And when you're asleep in bed, when we have people asleep in the operating room, you're supine, you're flat, and people get pneumonia post-op. And if you're set up for it and have undiagnosed bronchiectasis, then you're a candidate to get sick, unfortunately.
Now,
That's pretty good for a vascular surgeon, Jeff. I think we should, I agree with that answer entirely.
I'm learning from you guys.
well, the pulmonary embolisms were in my lungs, by the way. But I have a question for you, Jeffrey. When you travel, do you wear a mask? I've been told by my doctor, I wanted to go visit my niece in Italy. She's getting married, and he said it would be devastating for me. Even the plane ride, he wanted me to get some kind of medical insurance in case I needed to be evacuated out. So do you wear a mask? Does the travel bother you? Also, you're living in Georgia, and that's really humid. And we used to live in Florida. We moved to the desert because there's less humidity. The more humidity, the more bacteria in the air. And even the CDC on the internet says that if you have bronchiectasis, that you should not be living in a humid area.
As far as the mask, before I actually started treatment or went to National Jewish, we were going on a trip to Europe, but I knew I was sick, and I was like, I need to speak to somebody, and my partner's brother is a pulmonologist at Colorado, actually dean of the medical school. So I called him up, and he said, drink water. He said, hydrate on the plane. Don't worry about the mask. I will tell you, I travel with masks in my backpack. This past winter, with the flu season being as bad as it was the first time that I traveled and actually put a mask on, because this flu season, this past one, scared me. This one actually, last year didn't, for some reason, this one, I was seeing so many sick people in the hospital, I was like, I'm just, whatever. I don't even know if it will do anything. I'll just wear a mask on a plane. Normally, I do not travel with a mask. What I do when I travel, besides bringing all my stuff, I have all my medical records on my phone. So I travel with my notes from from Dr. Drummond at Jewish on my phone. So in case something happens to me and I'm in Europe, they have all my records. My CAT scan reports, everything is on my phone, which I think is actually probably not a bad idea if you have something. I don't, we have friends and they were like, we should go to India. And I was like, no. We should go to China. No. And there are certain places that I won't go now. But I know that there are certain places, like to go to Italy, I'll be fine. I mean, I know there are doctors there because I heard them present it in Milan. So there are plenty of places you could go and not let it stop you. You just have to be cognizant of the fact that, you just be careful. I mean, I remember we travel now because the kids are gone, so this is the time to travel. And we were in Greece and it was kind of dusty and windy on the island, and I was like, is the NTM floating around here? As we're going to be, and I was like, don't even think about it. Just enjoy your trip and live, because you have to live. That's the important part.
I get that question a lot about wearing a mask, and some of my patients do and some of my patients don't, but I think the idea of hydration is important, and also hand washing. So using hand sanitizers, is really washing your hands is very, very, very important. And I saw a relatively recent report that suggested that the risk of developing or risk of getting the flu, for example, during air travel is actually relatively small. So I was a little more heartened by that, but there are certain precautions I think are very important. And this is the kind of information I think is great to hear from the patients. Do you have time, Andy?
We have time for one more question. Anybody?
There's one back there.
I'm going to go to the back and the back here.
You guys are great, thank you.
When you're referring to traveling with masks or wearing a mask in general, what micron of filter or what size of mask are you talking about?
Typically, our patients will wear the respirator isolator mask for the flu that you'll see in the hospital, the thin yellow or blue ones. I typically don't recommend anything more sophisticated than that. And obviously, love to hear from some of the experts in the group.
So we don't need to wear a TB mask?
No, I don't think so.
A duck one.
Let me make one comment about traveling also. is, and it's, if you, like I travel with my pump, so I travel with all kinds of stuff. And when I travel, what I found is that trying to get on a plane was very difficult, okay? And the pump, like, I have a Hill-Rom, weighs a lot, you know, and so it's actually hard to get up on the overhead, and you need time. And so what I found the best thing to do was when they, if you're getting on a plane and they say anyone else need extra help, you get on early. And no one, you just get on early, put your stuff up early with plenty of time so you're not, because what happens is if you're in a mob scene of the plane, you start to get winded because you're, you know, and the last thing you want to do before you start flying is get winded. And so you have to use all the stuff that's available to you, and it's a lifestyle thing, and they offer it. And I would say, I mean, people look at me because for the most part on the outside, I look okay. But on all my carry-ons, it says medical equipment because I have my pumps and everything in it. And no one has ever stopped me. And if anything, they've been very helpful. And I think it's a good thing. That's great.
I'd like to add to that, too. Traveling with oxygen is a big deal because you have to have permission ahead of time to have the oxygen. And if you've got the oxygen, you've got your vest, excuse me, and all of your other gadgets. I mean, you've got a lot of stuff. And so getting all the extra help you have, even I ask for a wheelchair if it's a big airport because that saves. I don't stop traveling for anything. I might have an upset stomach, but from the pills, if I'm on them, I manage it some way. It's just like everybody here is saying, don't put your life on hold because you've got this disease. There are a lot of other diseases that are a lot worse that you have to put your life on hold. This one, part of the time at least, you can keep on living.
Thank you very much for that wonderful discussion. Thank you.